Hi everyone, my name is Melanie Grant, and this is C&M Glass. Today we're covering our topic HCPCS or HCPCS, which is our level 2 of professional-based coding for our introduction in class 1015. Some of the key points we'll focus on today are the structure of HCPCS coding, how it's categorized with DMEPOS, the modifiers, and then a little bit of basics on how to use the HCPCS code in looking up through the indices and appendices. The last topic we'll be going over are Medicare and Medicaid services, as well as some of the specifics for Blue Cross Blue Shield. I've also provided you here with 2 different websites that will be helpful in your learning for this week, as well as just as a really great resource as a coder. The first one here is our CMS website, which is www.cms.gov. This is where you would go if you want to find any information from Medicare or Medicaid, including rules and guidelines on how to bill and what's allowed, which most insurance companies tend to follow. The second website here is www.pdr.net. This is your physician's drug reference. If you haven't heard of this website yet, you will. This is going to be where you go to look up all information on medications, including generic versus brand names, including indications on who can take it, what kind of risk they have, what it's typically prescribed for, and even information on the drug classifications themselves. This is something you'll reference in many of your other classes, as well as a coder when you're looking up anything having to do with medications that we're giving or medications a patient is taking when you're talking about diagnostic coding in ICD-10-CM. So let's get started and let's talk a little bit about the structure. The first thing to be aware of is that unlike CPT coding, all of your HCPCS codes are alphanumeric, meaning there's a letter and several numbers. Most of your HCPCS are from A through V, although there's a few categories such as O that you won't find. The main reason for this with categories for 0 and O is they don't like to have 2 numbers together that look so similar. So your structure will be the letter first, the alpha, followed by 4 additional characters. So we have an example, A1, 2, 3, 4 here. You'll notice that's a little different than category 2 and 3 codes in CPT coding because those have a letter at the end of the code, indicating that there are either reporting services or temporary codes that aren't typically billed with. HCPCS coding does have some reporting services that won't necessarily include payment or may not be covered by insurances, but you'll be able to identify them from the letter first. Also, all the categories are based off of what letter you find the HCPCS in. So, kind of like how CPT had different sections based off of what number it started with, HCPCS does the exact same thing, starting with which letter is it found under. We'll go back to that in just a moment, and we'll cover over just exactly what's in each of those categories. For now, though, I want you to be aware that HCPCS exist. As an introduction to HCPCS, I wouldn't expect you to be able to identify everything that's in there or how it's coded. What I do want you to identify is what's in there and how would you reference it. Where would you go to the HCPCS book, or would you go to a CPT manual, or maybe one of the other coding systems for what you're trying to identify? Be aware that HCPCS coding is very unique, and it's kind of a hodgepodge of all coding for professional services. So most offices will reference something in HCPCS, but only a small amount of something. You're either going to use these codes or you won't in your field. So depending on where you go to work, you may never see these codes, or you may only see a couple of them, or you may use most of them. It just depends on what you're working in. So your goal for this class and for this week is to identify what is a HCPCS, how is it structured, and where would I find this? Where would I find this information? You'll find that HCPCS coding is actually quite a bit easier than CPT. So let's look at what is it categorized? The DMEPOS. DMEPOS stands for your durable medical equipment, prosthetics, orthotics, supplies, dental, and missing but also included are drugs. Okay, part of your D. So when they talk about DMEPOS, they don't include the dental and drugs, but it's kind of part of that same D. Starting with durable medical equipment. This is all of the equipment that a provider may send to you various supplies they may use for you when you're in the office. A lot of times, some of the durable and medical equipment may be something that's listed only for reporting purposes for the office or the hospital that you're staying at. They may need to report how many needles were used or how many bandages were sent out, or they may not report that at all. So it really depends on what's being used, and the DME portion of it actually falls under the section of supplies that you're given, not so much what's used in the office. Your prosthetics are any of your fake limbs or fingers in order to help a patient who has lost an appendage. Basically a replacement limb. So there's various different types depending on where it's located, what size it is, what type of prosthetic it is, how it was made, what it was made from, and those details will be found in the differences in codes. Orthotics are very similar, and a lot of students get confused with the difference between prosthetics and orthotics. So remember that a prosthetic is probably a whole something. So if we think of a whole finger, a whole hand, a whole arm, whole foot, whole leg, it's the prosthetic, it's the fake appendage. The orthotics are meant to help you. So they are supportive, they're on the outside, such as a wrist brace for patients who have issues with typing. Those would be falling under orthotics, a knee brace, things like that. And then your supplies, your dental codes, which are used by dental offices, not dental services in a hospital, and your drug codes. So let's look a little bit about those. If you turn on to page 910 of your textbook, which is section 30.3, the alphanumeric listing overview. Again, I just want you to be aware of what's included. So if we look at, starting with the A services, this is your services for transportation, including ambulance, from A000s to A0900s. Okay, so when we say transportation, you think A is for ambulance. So you have all of your ambulatory or ambulance services, as well as other transportation. So if you think about it, patients who may need travel from home, such as elderly patients on Medicare that cannot get themselves to their doctor's offices or are in a wheelchair, may end up having a specialized handicap taxi, and that would be something that would be billed under the A codes as well. And they have an example here for a non-emergency transportation, such as a wheelchair van. So ambulance as well as other transport. Ambulance services also look at what type of transportation, was it by air or by ground, as well as what was done during the ambulance transport. So if you have an emergency situation, you need to know if they're providing any kind of life-saving services. You have the difference here between advanced life support, basic life support, and specialty care transport, which may apply during the ambulance visit and may affect the code that you select. Additional A codes are for miscellaneous supplies. And so this is where we would put like the gauze or the bandages that are sent with the patient. This is not something that's typically covered or reported. You also have B codes for these. Oh, my bad. B codes are next, sorry. Let's see, miscellaneous supplies, vascular catheters, incontinence applications and care supplies, ostomy supplies, so it's just different kinds of supplies. And so I won't necessarily say know every type of supply that's out there, but know where to find a supply. And so you're going to find those under your A codes. There'll be things like surgical trays that a doctor would put together and use in the office. It may not be something that would be covered or should be billed, in fact, but it may be something the doctor would like to list in their office for purposes of reporting to show what was used, when, and where. The next one are your B codes, and these are for your intraoral and parenteral therapies. Okay. And these ones are basically just those supplies are very specific. So we'll put those under supplies here. That's why it was listed kind of together. This is very specific to nutritional feeding for patients that are not able to eat on their own. Your C codes are going to be some temporary codes that are used for some drugs, biologicals, devices, and transitional pass-through payments to hospitals. For the most part, C codes are going to be devices, mostly. And this might be something where the provider puts in a specific device into the patient. There's a code billed from the CPT, and then the device is identified with the C code. So these will work together in order to say, hey, we provided a service, and can you reimburse us for the cost of this device? So this is meant to bill the device, not the process of providing it. Your dental procedures are your D codes. And these ones are typically done in a dental office. Although you may see some dental services that are done in the hospital or in the doctor's office, they will not typically be covered under regular medical insurance. Now, that being said, could you move on into working in a dental office from this career? Absolutely. I myself actually started in dental. So I started using dental codes before I knew what they were, and working with an insurance company in bringing in patients and approving or denying their claims. And so it's a very small section, it's very specific to dental coding that you could do at some point in your career. Your E codes are where you find the majority of your durable medical equipment. So if you think E for equipment, okay, and they've actually broken this down a little bit to talk about what's considered a durable medical equipment. Most people think of, as I mentioned earlier, when you go in, you actually have like places you can go to pick up equipment from. So if you have the doctor write a prescription for a very specific type of chair, or a crutches that you might need to buy from a special hospital type service shop, this would be considered durable medical equipment, and that office or that shop would be billing that equipment to you or to your insurance using these codes. Now, your G codes are very unique, and these are Medicare specific. And we'll be doing a practice with these specifically, talking about Medicare codes. So when we go to that section, we'll talk a little bit about how to identify a Medicare specific service with a G code versus maybe one of the other codes that are found for lab testing, x-rays, or even services that are found typically in your CPT book. So these would be very specific for that. Your H codes are kind of the same thing. These are for substance abuse treatments. And again, these are going to be, these particular ones are Medicaid services. So they're very specific to the insurance and other insurers that may use them. Your J codes are your drugs. And these are going to be billed alongside of your CPT code anytime a drug is given, with the exception of chemotherapy drugs, or vaccinations, which are not technically a drug. So we'll talk a little bit more about that here in a moment, but these are going to be one of the most common codes pulled out of your HCPCS that will be used in most, if not all, settings. Okay. Your K codes are going to be specific to the area that you're in. Okay, so these are DMEs that are regional, and it's DMERCs, which are regional carriers. So if you have specific DME codes that your area that they want you to use, you'll use them from here for very standard and specific DME services. Your L codes are where you find all of your prosthetics and orthotics. And these will also typically be used in conjunction with your CPT code. If a provider is providing the service of applying the prosthetic or the orthotic or an office visit to the patient, and they happen to send them home with this device or this prosthetic, it's going to have 2 codes, at least one for the actual orthotic or prosthetic, as well as one for the service. And so something like, for example, a splinting, where a provider goes in and puts a splint on somebody's arm, will have both a code from the CPT for applying the splint, as well as a code from the HCPCS for the splint itself. So one in the CPT pays us for our service, and one in the HCPCS pays us for the item that we've given to the patient. Okay. The next couple are very specific and very small. They're not commonly used here in New Mexico from what I've seen, just kind of coding in the field, but you have your M codes. These are going to be very specific to therapy for cellular therapies. Fabric wrappings, they've given us an example here. But these are going to be specific to therapist's office, so we'll put therapy. Your P codes, which are some laboratories, and again, this is specific for Medicare and Medicaid. If they've identified that you need to use these services, they're temporary codes, and they're not to be used unless they're specified. So you do have lab services in CPT. So there's going to be times where you'll use CPT or HCPCS, and the answer to that is CPT is your default unless you're told you should be coding out of HCPCS. Same thing goes with your radiology codes, which are your R codes. So unless you're very specifically told you will be using those, you won't. Skipping for a moment over the Q codes. These are going to be temporary codes. Again, these are Medicare based. And this is another one that will commonly be used in the medical office from Medicare or other payers. You may find G codes as well, and we'll talk about that here in a moment when we talk about some of those specific codes. Now your S codes are also temp codes, but they're non-Medicare, and they're very rarely covered. More often, these are going to be your Blue Cross Blue Shield services, as typically these were actually developed differently. Instead of being from CMS, these came from Blue Cross Blue Shield and the Health Insurance Association of America. So S codes can be reported. It can be used for purposes of writing off services that may be supplied, but in the most part, these will not be covered by most insurers. So it's going to be another thing that's going to be very insurance specific. Do I need to use an S code? If the insurance company has said use this S code or use these S codes for services, then you will. If they don't, you'll look for an appropriate code in CPT instead, or it may not be a reportable service. T codes are also going to be specific to insurance. These are Medicaid temp codes. And so these will be very specific for Medicaid versus Medicare versus Blue Cross Blue Shield. Now the thing to keep in mind, Medicaid is for patients who need assistance or aid for financial purposes. This can be applied to anybody who meets within the Medicaid standards, whereas Medicare is to take care of elderly and disabled who are unable to do so themselves. So when you're talking about Medicare and Medicaid, it's important to distinguish the difference between those who may be elderly or disabled and need care, and those who may be financially disabled and need aid. Your last one is your vision. And again, these ones are going to be very specific to the office. You may not see these a whole lot. There's also some hearing services in here. These may be done in a regular primary care doctor's office for some of the screenings, but for the most part, you will not be using a lot of V codes unless you're in a specialized office. So that's just kind of an overview. Within the HCPCS code book, there's also a variety of symbols, some of them which you may notice are similar, such as new and revised. An O by itself, which means a code that has been restored that was previously removed. But the O with the line through it is for no payment for SNF or SNF, skilled nursing facilities. typically meaning that most payers will not cover for this particular service. Keep in mind, these symbols do change from CPT. So this one, for example, is modifier 51 exempt in CPT, but the symbol here in HCPCS means something else. A little square with a check is typically used with your drug codes as a reminder to check the dosage, meaning that there may be different codes for that same drug that have different charges based off of the type of dosing. So you need to pay attention to how is it given, such as intramuscular versus IV, as well as how is it measured, such as in liters or milligrams, milliliters, things of that nature. Then you have your gender codes, which are pretty much your male and female symbols, age and maternity specific services, and your deleted codes are identified by listing the code and having a line through it and all of the description for that code. So unlike with your CPT codes where a deleted code is simply taken out, your deleted codes here are going to be listed but with a line through them to say this is no longer active. Okay, so that covers most of just kind of the overview. What you should really identify, and you should do some practices this week with the coded studies yourselves. In your 3M, you're able to go in and identify your code finder for CPT and HCPCS services. Make sure you pay attention to when it identifies services for CPT or has something saying HCPCS codes when you're looking through those so that you get a HCPCS code, not a CPT. We'll be doing some practice with coding this week, so make sure you're looking at those. We'll also be covering some of the differences between Medicare services and regular CPT services. And so we're going to have a second video here in just a moment talking a little bit more on those so that you can identify some of those services specifically. Also, one of the things we'll talk about here that you should be aware of are modifiers, and you will find a modifier section. So I'm going to go ahead and clear off the screen and start a next video, which will be talking about modifiers, indices and appendices, and those Medicare versus CPT services. Join me on the next video and we'll see you in just a moment.